What's going on, yo? It's your boy Mike here with another video. So today's video we'll be talking about sternal precautions, and they can be used for many different procedures. Typically, the patients I see with sternal precautions are either CABGs, coronary artery bypass graft, are AVRs or MVRs. Now, sternal precautions. Why these patients have sternal precautions is because of how they access the heart. So for these surgeries as well as other surgeries, they go literally straight down to breastbone. They cut the bone to go to the heart that route. Now, it takes about 6 to 8 weeks for bone to heal. However, patients will feel better before then, generally speaking. Everyone's different, but generally speaking, people start feeling better before then. But again, it takes about 6 to 8 weeks for bone to heal. So sternal precautions, for these patients are very critical. Because again, you don't want that bone to heal misaligned. Because if it heals misaligned, that's not a good thing. It can cause maybe some breathing issues, some infection risks, things of that nature. So we want to make sure that with our sternal precautions that you're following these precautions very, very carefully. Now, there's a lot of precautions. I try to make things as easy as I can for our patients. So what you'll typically hear is that you don't want the patients to pull. You don't want them to bring their arm above shoulder height, and you don't want them to bring their arms behind their back. You don't want them to lift anything too heavy. So typically about a gallon of milk, which is about like 10-ish pounds ish or so, things of that nature. What I tell my patients is, you don't want your shirt to move. So if you're just standing there and you push, so watch. If I push, not trying to show up my gains or anything like that, but again, if I push, my shirt's gonna move. If I pull, it's going to move. If I move up here, it doesn't move a whole lot. But when I go up here, you'll start to notice that the chest starts to move a little bit. If I bring both arms back, it stretches the chest. However, if I just bring one arm back, it doesn't stretch the chest. It doesn't really stretch the chest as much. So patients are allowed to put one arm behind their back at a time. So they have to cross one arm in front and bring the other arm behind their back, so it doesn't move the sternum too much. Doesn't cause too much chest activation. But again, let's say if you don't want a patient to lift anything too heavy, because again, you can't put just that extra pressure on. And also, let's say you don't want them to bend down, because again, if you bend down, there's a lot of pressure on the chest. Again, and let's say if you're wearing a badge, whether it's a hospital badge, any kind of badge, or a lanyard or anything like that, and you bend down, what happens to your shirt? What happens to the badge? It pulls. Gravity is going to pull. So you don't want them to bend over, because you don't want the chest to move too much. Does that make sense? So if these things don't make sense, try them out. Stand up, stand in front of a mirror and just watch what happens to your shirt whenever you're doing these different positions. So, stand in front of a mirror, push both hands out, watch what happens to your shirt. Bring both arms back like you're pulling, watch what happens to your shirt. Now put both arms behind your back, watch what happens to your shirt. Now put one arm across and put the other arm behind your back, watch what happens to your shirt. Lift one arm just under shoulder height, watch what happens to your shirt. Lift both arms above shoulder height, watch what happens to your shirt. Again, bend down, watch what happens to your shirt. And sometimes when I tell that to patients, like, you don't want your shirt to move too much, they're like, okay, that makes sense. Because patients get told so many things so often, it's not even funny. So they're going to forget half the things we say. Bare minimum half the things that we say. So it's like, hey, to make it easy, you don't want your shirt to move too much. If I do this, my shirt's going to move. If I do this, my shirt's going to move. If I do this, my shirt's not going to move. But as soon as I do this, my shirt moves. And they're like, okay, that makes sense. So if the precautions don't make sense to you, just stand in front of a mirror, do these different motions, watch what happens to your shirt. It makes things so much easier. It makes things easier to understand. Also, you don't want patients to push, because we're always taught, if you're sitting down, reach back, guide yourself down or push up. You don't want them to push, because again, puts too much pressure on the chest. The bone's still trying to heal. You don't want it to heal misaligned or anything like that. It's not a good time. Now you're gonna say, how are patients gonna use a walker? Because we typically walk our patients with a walker. How they use a walker? You're able to use a walker. You're able to guide a walker, but you don't want to push on a walker like you're trying to do a dip. You want to guide it and use it as support, but not push off of it. There's a difference. Try it out. Use it as try it with just a general support, and then try and push on it and see how your arms feel, see how your chest feels, things like that. Now, getting out of bed can be a little difficult for patients. Because again, it's painful, and a lot of patients kind of push. A lot of people just push up to get out of bed. So I've taught my patients how to do a log roll to get out of bed. So again, if they're laying on their back, bend your knees, roll to your side, swing your legs over, and kind of like gravity help tilt you up. So that's a very generalized explanation of how to do a log roll. Some patients like it. Some people are like, okay, they'll try different things out. I'm just like, again, this is just one out of many ways to get out of bed. See which way you like, as long as you're not pulling or pushing. That's all that matters. Just don't pull, just don't push. Those are the main things. Another thing, particularly, again, I'm talking from a hospital standpoint. So just, relatively, I can talk about ICU stuff also. But even in ICU, the precautions are going to be exactly the same. So you don't want to push, you don't want to pull, you don't want to lift your arms above your head, things of that nature. Again, if you want to, patients can still wash their face, wash their hair, everything. They just have to T-Rex it a little bit. So here and tuck. You can do all this stuff. You just can't bring your arm up and do all that kind of stuff. So again, tell my patients, you don't want your shirt to move too much, and you want to T-Rex for a little bit until doc gives the clearance. Another thing I tell my patients is, if you're not squeamish, or if you know somebody in your house that's not squeamish, have them take a picture of your incision, either daily or every other day, just so you know how it's healing. But also, if something looks weird, you can send your pictures to your doc, your nurse practitioner, your physician assistant, your doctor's office, whoever is in charge of the procedure, and just say, hey, it looked like this on this day, it looks like this on this day, and then on pictures they have timestamps. Does this look normal? So if there's anything that you're unsure about, compare and contrast pictures, send them to your doctor's office and say, hey, does this make sense? Does this look right? Again, sometimes you can see some nasty stuff. If it's like an infection or anything like that, if it's an infection, it can be like very angry red, it can be painful. Sometimes it may be some oozing. Again, if it's TMI, I'm sorry, but that's just how it is. If it may be like a little bit tender, maybe a little bit red, but may not be too much red. And you also want to just like be aware of what your body is saying. So I always tell my patients, take a picture of the incision. If you have your pillow, hug your pillow. It doesn't necessarily have to be a pillow. Some hospitals will give the patients a heart pillow just as a reminder. It's like, hey, hold your heart, because you just had a heart surgery. If it has something with your lungs, they may give them a lung, depends on procedure, hospital, all these different things. But it's a good reminder of not using your arms. Another thing I tell my patients is, if they have a burp, cough, sneeze, something of that nature, and they don't have their pillow, just cross your arms, across your chest, light pressure, cough, because again, you don't want too much motion on your chest. So if you don't have your pillow, cross your arms, or just cross your hands across your sternum, cough, sneeze, burp, do whatever you gotta do, because you don't want too much flutter, because that can be kind of painful. So that's another thing I tell my patients. Another thing I tell them is, be aware of their energy. Energy conservation. Your body's gone through a lot. Your body is confused. It doesn't have a clue what's going on. It was awake, and it was knocked out, and now my chest hurts. So I'm like, hey, just be aware of what your body's saying. Your blood pressure may be doing some funky stuff, so you have to be very careful whenever you're moving. You don't want to stand up too fast, because you can get dizzy. Because again, your heart just had a major surgery. So be very, very careful whenever you're trying to change positions, because again, you don't want to fall out or anything like that. Oftentimes you'll see therapists, do warm exercises. And the way I describe that to my patients is, let's say your heart is an engine, your body is a car. And let's say you're in a place where it actually gets cold. Again, I'm in Florida, so it doesn't get too cold very, very often. But let's say if you're in Wisconsin, New York, wherever state where it actually snows. Let's say you gotta drive wherever. You're not just gonna put the key into the ignition, turn it, and just hit the gas. No, you have to warm it up. You have to warm the engine, and then you can drive. Same thing with your body, because again, your heart had major work done, and the blood pressure may be a little off. Maybe doing some funky stuff. Your heart's just trying to figure out what's going on still after the procedure. So doing these different exercises kind of like primes the heart, if you will, and tells it, hey, it's time to do a little something. So may get the heart rate up a little bit. You may pump the heart a little bit more, so your blood can get to where it needs to get to, from your blood to your legs, to your head, to your lungs, all these different things, just so blood and oxygen can get where it needs to get to. Now, we just finished our exercises, we just finished our walk, stairs, whatever we're doing. We get back to the room, we do exercises again, maybe a little bit slower, and then we chill. The reason why is because, again, you just did all this exercise, your heart rate's up, your blood pressure's up, and a good reason, because again, you want to make sure the blood's getting where it needs to, because you want to make sure that your heart is beating strong enough and efficient enough to get the blood from your head to your heart to your feet to your lungs, all where it needs to. However, whenever you're done working out, you don't want your heart rate and your blood pressure to stay elevated. So doing these cool down exercises tells the heart, hey, we're doing exercise, it's time to relax a little bit, because we don't want our blood pressure to stay up here. Because again, let's say if you're walking and your pulse goes to 100 beats per minute, that's not bad. Because again, you want to make sure that the heart is pumping efficiently enough and it's getting blood where it needs to. But if I'm just sitting here on the couch watching TV, my heart rate's 100, that's an issue. So telling them, hey, do some exercises to calm it down a little bit, relax, breathe, just focus on your breathing, so your heart rate can calm down a little bit. Then that's where we want to get to. Now, if it calms down too much, then that's something completely different. However, generally speaking, you won't see that as an issue. So, but you do want to tell your heart, hey, it's time to calm down a little bit, we do some exercise, so on and so forth. So you'll see that whenever doing therapy, you want to do some kind of warm-up exercises, just again to prime the heart. But with Sternal Precautions, again, you don't want your chest to move too much, and your heart has some major work done. So you want to make sure that your heart is primed and ready to do what it needs to do. So the patients that I work with the most often that have had Sternal Precautions, sorry, I had a burp. I said your CABGs, your AVRs, your MVRs. I think LVADs are Sternal Precautions also. That's a completely different surgery. They actually have a pretty much have like a box. They have to like learn how to change the battery. There's different precautions with LVAD patients that it actually takes a special. You have to do extra training to know how to what to do with the LVAD. Make sure that their batteries are next to them, because it's actually pumping for their heart. And oftentimes, sometimes patients will just live with an LVAD. Sometimes they use an LVAD to transition to a heart transplant in the future. So those are different things you have to kind of worry about. And they actually have to have specialty nurses to take care of LVAD patients. It's not just so even if you're RN, if you're RN without the specialty training, you're technically not supposed to take care of an LVAD patient, because the requirements are a lot different than a typical traditional patient, even if it's a CABG patient, AVR, MVR, TABR, which is a minimally invasive approach, different things like that. So again, LVADs, BIVADs. I think it's BIVAD, but I typically see LVADs. Again, something completely different. We talk about that a little bit later on. But again, just going back to the premise, Sternal Precautions. Be very, very careful. Make sure that if you are going to touch, make sure your hands are clean, because again, you don't want any infection on there, because again, they just cut your sternum open. infection sternum, that'll be a bad day. So you want to make sure that, stay clean as much as possible. Be very careful of your sternal precautions. So again, you don't want to push, you don't want to pull, you don't want to pull with both hands, you don't want to put both hands behind your back. One hand behind your back is okay as long as the other hand is across the chest. You don't want to lift your arms above shoulder height, because again, just see, so shoulder height, not bad. Above shoulder height, there's some motion. So you don't want to lift your arms above shoulder height. Again, you wash your face, just got T-Rex a little bit. You're not allowed to bend over, because again, gravity pulls on the chest. It's not a fun time. So you're not allowed to bend over too much. You have a weight restriction of what you can lift. Usually about, depends on the doctor also. It's usually about between 8 to 15-ish pounds. Depends on the doctor. Depends if they're a little more conservative or not. Those are some of the big things to pay attention to. Pay attention to energy conservation. Pay attention to how the patient even gets in and out of bed. Pay attention to how the patient is using their walker, if they are using a walker. And those are some of the big things I would say. And just be honest with the patients. And one thing I always do whenever I'm walking with my patients is after the walk, I'll say, hey, how do you feel? Was this easier than you thought? Harder than you thought? Or right where you thought it was going to be? And I'm like, yeah, just be honest with me. If this was too hard, we can bring a chair follow so you can sit down, take a break when you need to. If it was too easy, we can increase the distance. If it's right where you thought it was going to be, perfect. And the feeling that you want is that you want to feel like you've done something, but you don't want to feel like you're going to be completely pooped for the rest of the day. So if you feel like you're pooped for the rest of the day, that means you've done a little too much. If you feel like I ain't doing anything, we can push it. But if you feel like, hey, I just need to take a little break and I can do something later on, perfect. That's where you want it to be. Those are pretty much some very, very basics about sternal precautions. And again, each doctor may be a little different. Some may be a little more conservative. Some may be a little more, hey, let's go for it. Again, read your doctor's notes also. And again, I always tell my patients, if you know someone who's not squeamish, take a picture of the incision. Take a picture daily, every other day, just so you know what it looks like. And if you have questions about it, if you have any kind of question about the procedure, ask your provider. Ask either the surgeon, their nurse practitioner that worked with them, their physician's associate that worked with them, whoever is in charge of your surgery. Ask them all the questions that you can. Send them pictures. Is this okay? Is there anything I should be looking for? And again, as a provider, as a PTA, ask the patient, how does the chest feel? Ask them how their leg feels. Particularly if they had a CABG, sometimes they'll do the vein harvesting from the great saphenous vein, if I'm not mistaken, in the leg. Because it has a lot of different peripheral blood flows and things like that. So they usually use a great saphenous vein. So I'll say, hey, ask the patient, how does your chest feel? How does your leg feel? Any questions that you have? Again, while you're walking with the patient, or when you get back to the room or before you walk, hey, is it okay if I take a look at your incision? How does it look? Does it look calm? Does it look angry? Is there any discoloration? Is there anything seeping from it? If there is, does the nurse know? If there's any discoloration, does the nurse know? If it looks super angry, does the nurse know? Communication. Because you may not always see the doctor, but you'll always see your nurse. Because if you're doing it right, you should be asking your nurse for permission to see your patients. And you should be giving a handoff after you see your patients. Continuity of care. Again, things change very frequently. In PCU, things change frequently. In ICU, things definitely change frequently. So pay attention to those things. And again, rate of perceived exertion. How do you feel afterwards? Do you feel good? Was it too hard? Was it too easy? Just ask your patient these things. Communication with your patients is key, particularly with surgery patients. So that's pretty much what I got for you guys. There's all sorts of things I can talk about. I may do an ICU video. I may do some knee precaution or hip precaution videos. Let me know what you guys want to see. But that's what I got for this time. Until next time. Later.